Well, obviously, when you're contemplating a pregnancy, you want to make sure that your health is where it needs to be so you can have as healthy a pregnancy as possible. And one of the first things is, once you're pregnant, you're going to need to find a physician if you don't already have one. So when you're picking a physician, of course, I think at Generations, we rely on word of mouth of our patients that they will have a good experience, and then they'll refer their friends and family members to us. But I think it's also important to think about, the location where the physician practices, where they deliver, who's going to deliver the baby, do they share a call with other physicians, do they see you for your prenatal visits, or do they have other physicians or nurse practitioners in the office that provide that care? And I think it's also good to maybe go and meet the physician and try to get a little idea about their philosophy, about how they provide medical care for their patients and how they interact, because it really should be a partnership between the patient and her physician. When preparing for pregnancy, I think it's important to take a self-assessment of your own health and your own needs, but also if you don't have a physician yet to do your OB care, then it's important to pick one. And we want our patients to come in actually before they get pregnant for a preconception care visit, because the first few weeks of pregnancy are critical, and we want to make sure that your health is where it needs to be and answer any questions you might have before you actually become pregnant. There are important things that would take place at a preconception care visit where we would discuss the patient's history, we would probably go into their family history, and if there were any genetic things that we need to be aware of, that we can offer screening and testing to them for prior to becoming pregnant. If you are on regular prescription medications, it may be important that you continue those medications during the pregnancy, because those conditions may require continued treatment while you're pregnant. But we may need to make changes in those medications because there may be some medications that are safer to treat that certain condition during pregnancy than others. When we see a patient at her preconception care visit, of course, we're going to take a very careful history. And we're going to ask her about immunizations. We're going to ask her about whether or not she has immunity to chickenpox. We're going to ask her about any medication she may take, any habits she may have, such as smoking. We're going to offer screening for certain conditions that she could be a carrier for. What that means is that she's not actually affected by the condition, but she may carry a gene that could be passed on to the baby, and there is an opportunity that if she would like to be screened for that condition or that carrier state prior to pregnancy, she could. Certain conditions may have a genetic origin, and the parents may carry a gene or a trait for that condition, but not have the actual condition themselves. And if both parents have that trait, they could pass that on to the child. And so we want to educate patients about what conditions are known and what testing is available to screen for the carrier state of those conditions prior to pregnancy, when they have more options to consider. So particularly at this time, we spend a little bit more time talking about travel at the preconception visit, because quite often these patients may be considering travel. They may be getting married or may have recently married, or they're planning vacations or honeymoons, and they're planning to travel to a tropical location. And of course, we're now more concerned about travel in the Zika virus. So currently we're concerned about travel prior to and early in pregnancy related to the Zika virus. And there are travel restrictions now currently in Central and South America and the Caribbean. And so we want to have a chance preconceptually to discuss with those patients their travel plans and make them aware of those situations so they can prepare appropriately.